So here are the two. In my world, the first thing I want you to know is that you are the boss when you are receiving. I actually have a great resource for preparation of a cesarean, but I think what would be the best in this case are the top 5 things to do immediately after your cesarean to really take care of that scar, since you're asking specifically about that scar. So check out that free resource down here below. I teach cesarean scar massage is actually with no lotions or creams at all. 2 reasons for that. The first is that you can actually get really great drag on the tissue when you're doing a dry massage, and that has a huge impact on the fascia, scar tissue, the tightness, and any sticky things that are happening. The second reason is that straight up, you're busy. How are you having lotions and creams lying around whenever you get the chance to do your scar massage? But if you do, it's not incorrect to use them. They just may not allow the techniques that I specifically teach to be as impactful. That's all. The majority of cesarean incisions are made through the pubic hair line, so ingrown hairs can be a challenge for some moms. So to prevent ingrown hairs, here's one thing. Instead of shaving clean directly on the skin, try to leave a little bit, like a couple of millimeters of hair growth at all times, so that there will be no opportunity for ingrown. But if you already have an ingrown hair, a couple of things to consider. Please don't try to pinch it or pop it out. You don't want to disturb that scar healing. Put warm compresses on the area just to try to coax that hair to grow out, and then follow suggestion number 1. Now, if there is a localized stubborn infection, please do see your physician just to make sure you take care of it. But if you don't, please don't leave it, because it can really the scar can grow into and around the hair. To this pregnant mama, what you may be describing might be PGP, or pelvic girdle pain. Not exactly sure the location of what down there means for you, but if you're referring to actual pelvic floor heaviness, that is also possible. All these things can mean a couple things. The first major thing is that you may just have pushed it. So the body and its muscles and its ligaments and its joints might be like, holy cow, we haven't trained for this kind of high impact load, and therefore we're just pooped and tired. So give it a rest. A couple of days should be fine. But what is more likely is a combination of fear. And so when we're trying something new, especially when pregnant and jogging, that might cause the muscles to tense up, creating a lot of pain. Bottom line, get it checked out by your perinatal therapist. The first thing I want you to know is that you are the boss when you are receiving treatment from your therapist. You are in charge of leading how that treatment is going to go. So tell your therapist, that hurts too much. Please go later. Or ask her, I'm assuming it's a her, ask them, what are you doing, and is it beneficial to be at this level of pain? The way I work with my athletes when I'm doing manual therapy directly on their body is I tell them about using a pain scale from 0 to 10. 10 being excruciating pain, 0 being no pain at all. And I will tell my athlete, this is what you should expect during this particular technique. I want a 0 out of 10 pain. Oh, and then she knows, oh, okay, this is what I should expect. Or if I'm doing an advanced technique, I'm like, listen, 4, 5 out of 10 is appropriate if you can handle it. Do you want to try it out? And the answer is yes. So it's always consensual. In my world, cesarean scar massage starts after you are discharged by your doctor. That's around the 6-week mark, here in Ontario anyways, when you see your follow-up visit. Now the reason for that is because you want to make sure there are no infections, because you don't want to massage infections, and that there is perfect full wound closure, because you don't want to be massaging a wound that's got little openings either. Now, this doesn't mean that you can't do anything up until the 6-week mark. There's actually a handful of things that you can do that'll be massively impactful. So if you're in weeks 0 to 6, I have a free resource down here below. It's the top 5 things that'll be super helpful in those first 6 weeks before you start actual scar massage. This is fantastic. Vertical or classical cesarean scars definitely will benefit from scar massage. And it's a necessity. I mean, the general healing of a vertical scar, if left untreated, is higher likelihood of becoming adhesed than a horizontal scar. And the reason for that is because there is a vertical scar right down the middle of your abdominal wall. So that external scar is highly likely going to adhere to that secondary incision. So please start scar massage as soon as you're discharged by your doctor. And if you're not sure how to do it, come to my scar massage workshop on Wednesday. You're going to learn some techniques that are going to be great for you right away. You're going to learn how to do it safely. You're going to learn why you need to do it. And then you're going to learn a little bit about the exercises you want to do to keep those changes. Check it out. So here are the 2 reasons why you won't need to do any more scar massage, the way I teach it anyways. The first one is you have no more pain or discomfort comparing the surgical area to an area of your abdominals where there was no surgery. So in simplified terms, below your belly button should feel the same as above your belly button, okay, that whole area of your abs. The second reason why you won't need to do any more scar massage is that the mobility of these 2 areas are the same. So again, to summarize, pain is the same and mobility is the same. So you're back to normal tissue sensation and mobilization. Make sure though that you have gone through an entire series of scar massages. You want to go from simple to advanced. You want to get really deep. And if you are not too certain if you've gone through the entire series, come to my scar massage workshop on Wednesday, because I'll be teaching some advanced techniques too. It depends on the cause of your particular C-section shelf. Did you know there's over 9 causes? Now, in the first couple of weeks, for sure, after cesarean, first couple of weeks, the cause of that overhang is due to swelling and a tight scar. So compression is going to really take care of it, and so is scar massage. Now, if you're kind of past that 6-month, 1-year mark, please take a look at this resource down below. That C-section shelf, there are so many ways that you can approach to find a solution to help it heal, but you want to find out what your cause is, right? Find the cause, then follow up with the correct solution. I'm assuming this question is after a cesarean. When is it okay to drive? When you can safely turn your head quickly, react with your body to prevent an accident. That requires a lot of core control and core strength, quite frankly. So that will come with time for sure and with training. But I would suggest definitely wearing some kind of compression garment will really help for the first couple of times that you go out for that drive. Same thing with lifting. I mean, depends what you're lifting, right? If you're lifting something heavier than your baby, you actually really want to have your ABCs down pat. Your ABCs are your alignment, breathing, and core control. These are your foundational parts of core rehabilitation. And what happens if you start too early? Well, there's a risk of further injury, right? You could strain a muscle, you could injure the actual incisional area, but just go slowly and you'll be fine. I love exercise questions. So here's the thing. The cue I use is to zip up. So imagine you're wearing a sweat top, right? And you're going to zip up your sweat top. It starts from below. So if you place your hand on your scar and you place your hand above your belly button and you gently engage your transverse abdominis, make sure you feel that bottom hand actually move or draw in or engage or whatever cue you use. So the zipping up in your mind's eye, imagine that you're doing it in order from below up. And in real life, I mean, that probably happens in nanoseconds, so it's not really even a volitional thing. But the big thing is that you do connect your brain with your surgical area or that lower ab area.